Hello, South Florida and beyond, and welcome to How to Stay Healthy here on 95.3 AM and 1470 AM. We're going to go across the universe of health here on this show. And if you have any questions for the physicians we have on, the number is 1-888-565-1470. So without further ado, I want to introduce our first guest. Really excited to have on the program Dr. Essie Yates, plastic and reconstructive surgeon. Dr. Yates, how are you doing tonight? And welcome to the program.
Hello and good evening, everybody. I'm doing very, very well. I'm super excited to be here, and hopefully you can give some informative answers to the questions as we go along tonight.
And thanks for coming aboard. I realized that you did do surgery this afternoon in Fort Lauderdale, but you're on staff at a whole bunch of other hospitals we'll get into. So thanks for coming to the program. You have offices across South Florida, and you're at we were talking a little bit briefly, you're on staff at a whole bunch of hospitals. Tell us a little bit about your background, where your offices are located, and where you're on staff at.
Okay, so the short version of my background is I'm British. I'm medically trained in England. I did medical school there, moved to America, at which point I did some research at a Plastic Surgery Institute, which is quite esteemed in New York, at Memorial Sloan Kettering Cancer Center. And shortly after, was appointed as a plastic surgery resident for my training at the University of Chicago. Once that was completed, I joined a practice here in Fort Lauderdale with a very esteemed senior plastic surgeon, Eric Stelnicki. We're affiliated with the Cleveland Clinic, Barry, and Nova University, where we instruct and educate medical students, PA students, and residents. And I work throughout Southeast Florida, doing a blended practice of both cosmetic and breast cancer reconstruction. I'm affiliated with multiple hospitals that I service through my 3 offices, my main one being in Fort Lauderdale, one in Boynton Beach, and one in the western suburb. I work at hospitals throughout the Memorial System, Broward System, and here close to home at West Boca Medical Center.
Now, you mentioned breast reconstruction as one of your areas of interest. So is this a reconstruction that's done after a mastectomy or a surgery for cancer?
Yes, that's exactly what it is, David. Breast cancer is a very devastating thing, and it can be life-changing for women, for their physical appearance, for their esteem, and just overall well-being. And I really take much pride in restoring confidence and physical form after these kind of surgeries. And essentially, once the cancer is treated, whether part or all of the breast is removed, and myself and my team come in to restore and enhance the breast. And sometimes we can even make it better than it was before cancer, which is a silver lining for these women that have been through so much.
Now, is this treatment done right after the surgery for cancer? Is there some kind of, sometimes it's staggered, and you kind of perform it down the road at a better time?
Again, that's another great question, and it's very patient specific. The simplest way to kind of separate it is for most patients that won't need radiation after their surgery, we can go ahead and do the reconstruction at that time. For those that will need extensive radiation or chemotherapy, they're normally candidates for what we call a delayed or not at the time of mastectomy reconstruction.
And what is the recovery time? I know each case is different, but what is the recovery time for a breast reconstruction?
Well, I mean, the reconstructions that I perform are cutting edge, and some of them are novel techniques that aren't offered by all plastic surgeons. But being a woman myself, I really made it my passion and interest to push the envelope and to be able to service patients with the most novel techniques. I broadly divide reconstruction into 2 categories. One that uses implant-based reconstruction. Each surgery I do normally has a recovery time of 1 to 2 weeks. The other surgery I do, which is unique to just a very small percentage of plastic surgeons, is tissue transplant, where we essentially do a tummy tuck or remove tissue from the abdomen, thigh, or buttock, and we transplant that using a microscope and sewing very, very tiny vessels that are with sutures so small it's finer than your hair. But what we essentially do is transplant that the same way you would a heart or a kidney. We transplant the fat from the tummy, where often women don't want it, to their breast post-mastectomy and shape and contour it to make a beautiful natural breast, so they do not require an implant. sorry,
Go ahead.
the recovery time for that is a little more extensive, somewhere more in the region of 4 to 6 weeks.
So we talked a little bit about breast reconstruction. On the other side of it, you do cosmetic breast augmentation as well. Is that part of your practice?
That's a big part of my practice. The breast is one of my main focuses, together with the face. And I do a whole spectrum, including breast reductions, breast lifts, breast augmentations, very much your patient-specific procedures. We will come with our complaints and our wishes of what we want to look and visualize differently, and I'm here to provide that service and allow him to feel more confident about their feminine attributes.
You mentioned a little bit about facelift and mommy makeovers. Now, on the other side of things, traditionally we think of these kind of enhancements or cosmetic surgery for women, but are you starting to see a trend of men as kind of men are becoming more comfortable? And the way I put it is like 10 years ago, I wouldn't go out and get a manicure and pedicure. Now I won't cut, my own fingernails or toenails. Like it's like that stigma or whatever what was there is kind of over with, and now men are taking the time to do something about anything that's bothering them with their looks, maybe a confidence thing.
Yeah, I mean, I think that historically the cultural norm was that plastic surgery was an interest reserved for women. And I think in today's society, especially with the advancement of social media and people's physical awareness of themselves, there's a recognition that men too have aspirations to look and to feel better, and that there very much are people like me out there that are really willing to give a comprehensive exam and to figure out the troubled areas and to make a tailor-made plan to address in a way that is subtle and with private recovery and with hidden incisions that allow them to express themselves and to be the best version of themselves and take advantage of the fact that there are plastic surgeons out there to enable them to do that.
Yeah, so men and women, what age of patients do you see? What's the main range?
Well, I'm an adult-focused practice. Men, as you previously mentioned, are a very large and growing portion of my cosmetic practice, which is exciting and really interesting to me to be part of this new trend. And, we see men from all ages, but typically from mid to late 30s, right up to their 60s and 70s. For women, I deal with patients all the way from adolescent because I do some reconstructive procedures, people with birth defects in the face or breasts, and treat them all the way from teenage years. And I think my oldest patient is in her 70s. So I think everyone is motivated these days to really find out what's out there. And there is something for everyone, both surgical and non-surgical, that can allow them to enhance the way they look and feel.
In terms of men's health as well, is there a surgery for breast reduction for men? Maybe someone who's lost a lot of weight, maybe from like a bariatric surgery or whatnot, and put the time in the gym, but still kind of has, a female-looking breast,
Yes.
if I say that. And is there something that you can provide for that as well?
Yes, there definitely is. There's two main complaints that men have with dissatisfaction with their appearance, so their chest, breast, or pec area. And one can be sagging skin, if you mentioned after massive weight loss. And there are skin excision procedures where we make very fine scars that are subtly hidden in the shadows of the chest to get rid of that excess sagging skin. Much more commonly, though, what I see within my practice is something called gynecomastia, which is a male enlargement of the breast, which is actually breast tissue. It's hormonal. Sometimes we see it in teenagers congenitally. We don't know why they get it. Sometimes in people that have had a lot of testosterone. Sometimes in people that have had some excess weight. And those feminine-looking breasts not only have excess skin, but have excess breast tissue. And that's something that we can normally break down with what we call ultrasounded with assisted liposuction, which is an energy that's transferred to the fat cells to break them up. It allows us to suck out the extra bulk and breast tissue, and it causes a retraction of that surrounding skin, so it's lifted back into a much more masculine-looking pec and chest area.
Is that something that's done inpatient in the offices, or does that have to be done in the hospital and require a hospital stay, the liposuction?
So liposuction, depending on the amount, for something like the chest, which we just discussed, that's a same-day procedure. We do put
Oh, wow.
patients to sleep, but it takes a few hours. They go home. There's a regimen to follow in terms of aftercare and garment wearing, but it is a same-day surgery, and for most people at work or go to school, they can very much find themselves back doing their usual activities within 2 or 3 days. So if we do surgery on a Friday, many times we can see you back on a Monday. For more extensive liposuction, where we're perhaps liposuctioning multiple body parts, abdomen, thighs, arms, back, flanks areas, those patients, for very large volume, I occasionally admit overnight, one-night hospital stay, and it's more like a week recovery with some really important restrictions and garment wearing post-op for 4 to 6 weeks.
We've kind of crossed paths around the body here today so far. Now, I find it interesting that when we think of plastic surgeon, I'm talking like a common man like myself, we don't think of that you're someone who can treat pretty much any part of the body. It's head to toe. It's not specific regions. Is that correct?
Yeah, and that's what's beautiful about plastic surgery. And I myself am hopefully shortly going to be a board certified plastic surgeon. It's a 2-year process, which I have passed 2/3 of the examinations, and I have the last one coming up. In addition to that rigorous board certification process that we go to, it's the longest specialty, only comparable with neurosurgery, which are brain surgeons. We operate children and adults head to toe throughout our training. And most of us, once we go out into practice, really find a niche, something that we want to dedicate our career to, despite training across the specialty, training longer and often harder than almost any other medical or surgical specialty. We choose one or two things, and as we've talked about, my choice was breast cancer reconstruction and cosmetic plastic surgery.
Now, is cool sculpting a form of liposuction, or is that a little different?
It is a little different. Conceptually, it's the same thing. We all want to get rid of that stubborn fat that we don't like, and that tends to hinder us from
No
being...
matter how hard you work out in the gym, it just won't go away kind of stuff.
Yes. And actually, that's the best patient for cool sculpting, someone who has really made tremendous progress and may have a stubborn area, love handle in the flank, on the tummy, on the arms.
It won't go away with diet or workout.
Correct.
Yeah, it's just there.
Yes, and the beautiful thing about cool sculpting is it's non-surgical. You do not need anesthesia. You can literally do your emails, read the newspaper. It's a little suction device that attaches to the stubborn area and puts that skin and fat through a freeze-thaw cycle. It feels cold and a little firm, and voila, you remove it, and that fat melts away in the coming days. For people that have a little more larger fat deposits, liposuction is certainly the way to go. And if those fat deposits are combined with some excess skin, normally a tummy tuck or some other kind of fat and skin reduction procedure is usually the way to go.
Well, Dr. Yates, thank you so much for joining the How to Stay Healthy show tonight. Again, Dr. Yates, number is 954-983-1899, AtlanticCenterSurgery.com. You can find out more information. Thanks again for coming on the program.
David, thank you so much for having me. I really love this show, and I think it's great to educate and empower, all of our listeners to know what's out there and to be able to make great health choices.
Perfect. Thank you.
Thank you.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You have been listening to the Concierge Men's Wellness Show. Visit our website for more information at conciergemens.com. And if you have a question, call into the show at 888-565-1470. Now, back to our show.
And we're back here on How to Stay Healthy. And I'm really excited to have on the second half of the program here an interventional neurologist, and an interesting case that he just had Dr. Nils Mueller is part of Palm Beach Neuroscience Institute and on staff at Delray Medical Center and St. Mary's Medical Center. And doctor, correct me if I'm wrong, Florida Medical Center as well?
Yes, correct.
All three. So I'll just pull that right next to you there, doctor. So tell me a little bit about this case from the clinical perspective. And then I'd like to hear from a little bit from the patient point of view without the doctor.
I probably have to step back 2 minutes and really talk about the groundbreaking changes that have taken place in stroke care. Since 2015, we now have transitioned from just being able to give clot-busting agent in the vein to really pulling out the clot, which is much more effective with a device from the groin. So we went from just an IV to actually catheter-based treatment, and that is now standard of care. It's been validated all the way out to 24 hours. Many hospitals are doing it, and what we're fighting now is to actually get the care to the patient as quickly as possible, limiting everything that slows us down in the process. And Carol is an interesting example because she went through the procedure awake. She can tell you what the symptoms of the stroke were, and so she very eloquently can narrate what people should look for when they have symptoms of a stroke and then what happened to her in the hospital.
So, Carol, take us through your story. I mean, we talked on the phone earlier today. You were in Jupiter, you're in Boca, you're in Delray. When did this happen? And you seem to be 100%. So take us a little bit full circle, if you would.
Yes, it was in 2015 when it wasn't standard of care at that time. And I take Coumadin for a leaky valve, and I'm on it all the time. I never had any problems with it. Got my blood work done once a week, but I happened to have a normal day. The day that it happened, just got up at 5 in the morning to go to the restroom, and when I got there, I fell, and my whole left side was paralyzed. It just hit me like that. It was a day like any other, and I was able to crawl to the phone with my right knee and my right elbow about 5 feet into my bedroom, my cell phone, and I called 911, and they were there immediately. But I was surprised at myself that I wasn't upset, but I did perform what I should have performed in giving them the right information. And then I met Dr. Mueller in the hospital, and I was in the emergency room, and then they put me in for the operation, and I was awake with the twilight drug, I guess it was, and I realized what was happening, but I didn't know what he was going to do. And he did say, he said, Carol, he said, you have to trust me. He said, I'm going to go up through your groin and take the clot off your brain. And you have to be very still and not talk and everything. And I did say, the more that I trust you, and as much as I trust you, I trust God that's going to be guiding your hands, because, I believe that. But after that, I was awake. I didn't really feel anything, and I did start crying when I felt my toes wiggle and the life come back into my left side. And he said, Carol, don't cry, because I have to make sure I get it all.
Oh, wow.
So he did, and God bless him, he did. And I walked away 28 hours later with no neurological effects, no dizziness, no speech defects or anything to my home.
Unbelievable. Were you familiar with the FAST acronym before that? Like we always hear Dr. Mueller on this show and other shows, face, arm, speech, and time?
Yes, I was.
And
I knew what I was having.
Oh, you knew it?
I was
Okay.
prepared, because I knew the dangers of Coumadin and having my blood get too thick, so a clot would form. And that's what I live with every day of my life.
So, Dr. Mueller, was this a stroke alert that you were called into then?
Correct. So one thing that in 2015 Carol was lucky with is that she lived close to our hospital, which is a comprehensive stroke center. Had she in those days lived next to a primary stroke center, she would have gone there first. They would have had no treatment option because she was on Coumadin with an appropriate level of Coumadin that basically rules out the IV clot-busting agent. Then with a delay of about 2 hours, she would have been transferred to us, and her outcome would have been much worse. She came straight to the right hospital. We've changed our system since then, and now every stroke patient, about 93% of all stroke patients are now directly taken to a comprehensive stroke center in South Florida. We've worked with EMS closely to create those changes, and hopefully now every patient every time gets this treatment. And the goal right now is to get our response times down. So what we're working right now is to get pre-alerts from the paramedics so that when they're in her apartment seeing that she has a stroke, they have a score called the RACE score, and they're going through that. And when the score is anywhere above 5, they signal to us, well, this is a previously functional lady with this score. We have a high probability of what we call a large vessel occlusion. So they come in, and at that time we may already call in the team to bring the have everybody there by the time she gets to the hospital. We've had a number of patients where we met the ambulance in the emergency room. We're able to go right to the interventional suite and cut those times down dramatically.
And this hospital that this was done at, you're talking about, is Delray Medical Center, this particular case?
In her case, it was Delray Medical Center, but we have a number of comprehensive centers that are actually aligned in what we call the Advanced Neuroscience Network, and our numbers are being reported, and we just published a national paper where we were being credited because we were the largest enroller of those patients. And we're very proud of the data that we have. And every day, though, it's a fight. You have to, every time you have to get the numbers down and optimize your process.
So during that process, your team's getting the score from the paramedics or fire rescue team.
Correct. And then I have to make a clinical determination. Is this appropriate information to call the team in? Sometimes we wait for the CAT scan. Sometimes we initial special CAT scans to see what we need, for instance, for wake-up strokes. And then we decide we go straight to the procedure, and the procedure is effective over 85% of the time.
Carol, how soon did you walk out of the hospital after having this procedure?
28 hours.
Unbelievable. That is fascinating.
He put me on bed rest. I had the operation at 7:30 in the morning, I believe, and only took an hour, I think. And I was awake, and I didn't feel anything because I was, had a certain type of anesthetic. But anyhow, I had never heard of anything like that. Although I kept up on stroke awareness, I was very baffled that I was a recipient of a new procedure that was just was only in effect in 2 hospitals at that time in Broward County. In Palm Beach County, and I was taken to the one closest to me, which was lucky for me and blessed for me.
Yeah, definitely. Now, Dr. Mueller, take us full circle here. This procedure years ago, how was it done? And then you told us today that you're doing it through the groin. This is through I guess maybe a couple millimeter sized catheter that you're able to go through the...
So the device has only been around since 2012. Initially, it was only limited to certain tertiary care hospitals. It's now available in the community, and the goal is obviously to make every patient have access to it. It's difficult because you need a very skilled operator that has the experience of doing at least 30 of these cases a year. Otherwise, the procedural outcomes aren't as good, and the time frames of how long the procedure takes is longer. So the goal is to expand that access, and people are using all kinds of technologies to do that. They put CTs in ambulances, which for our region doesn't really work well because you can get to the hospital quicker than you can get to acquire the scan in the ambulance. So for us, it's best to just call 911, be aware of the stroke symptoms, and get there very quickly. And about 20% of patients in South Florida are receiving clot-busting agent within an hour from their symptom onset, which is really pretty impressive. Florida is really leading the nation in their stroke system.
And those symptoms, take us through that again. I know we've heard the FAST acronym, but you say it better than anyone else.
Well, the most important thing is a new deficit. So if you have a new deficit that you recognize in your loved one, look for sudden drooping of the face. That's what the F stand for. Sudden arm weakness, usually one-sided, where one side doesn't work, drops. Sudden problems with speech, sudden difficulty with understanding, expressing yourself, slurring of speech. Then time is of the essence, so that's fast. And then you should call 911. Don't drive in by yourself. It always takes longer to be triaged. It's better to come in with 911 because they can give us the pre-alert from the field.
And time is what you ended on there. Why is time so important in stroke care? Why are those? So she had her stroke around 5 o'clock. She was already treated by 7:30. Why is that time so important?
Every minute you lose about 2 million nerve cells, and so the stroke deficit grows progressively the more time elapses, and that's why these transfers from one hospital to other are so detrimental to the patient. You really need to go to the right hospital to begin with, and you have the right system of care in place so that they can pick out a stroke patient and take them to the right hospital where this interventional or catheter-based therapy exists.
And Carol, how do you feel today?
I feel fantastic and amazing and unbelievable. I feel myself. I feel no different than I did in 2015. But I'm very aware of everything, keep close contact with my doctors and follow up on everything, and keep control of my diet very closely because at certain times, even before the stroke, I had really stayed away from all of vitamin K, which thickens your blood, and that's what could cause a stroke. So we used to go to Quest, and now I monitor at home twice a week, and I take my own blood count, and it has to be between 2 and 3, and I have to measure my vitamin K content each day according to that.
Right.
And I do it with, I told my doctor today, I went to see my doctor up in Jupiter today, and I said, I have this system where I look and see what my points were last week and what I did to get to that point with vitamin K, and then I either go up or down on it, and I got it pretty down pat between 2 and
Yeah, it's tough at first, right? But then you do it over and over. It's like anything else.
But your body
Right.
changes too. At first, I needed a lot more vitamin K to, get it at that level. But it's trial and error, and it's keeping your finger on top of it. It's keeping aware and what you're eating, and I eat healthy anyhow. I plan to do that the rest of my life.
Carol is the best example of how cost-effective this treatment is, because if you looked at the patient care that she would have had before these devices were invented, there would have been a significant stroke. She would have had disability. She would not have been able to return home or work. She's still working. So these procedures really not just save lives, but they save quality of life. And I think that's the most important impact, and people need to understand time is really of the essence. Time is of the essence. Call 911. Get to care as fast as possible and go to the right center right away.
Dr. Mueller and Carol, I want to thank you so much for coming on, and thank you so much for telling your story.
Thank you.
It's an amazing story.
You're
Now, it's
welcome.
always amazing with you, Dr. Mueller. You can find out more about Dr. Mueller at pbni.com or 561-882-6214, part of the Tenet, Florida Advanced Neuroscience Network. You can look that up as well. Thank you for listening to How to Stay Healthy.
You have been listening to the Concierge Men's Wellness Show, making men feel great again and making their mates smile. Call us at 954-513-4646 and let us specialize in making you and your mate happy. The opinions expressed on the preceding sponsored program were strictly